at any time. But if we do, by any means, he goes out to look at what can be done, or what was the cause, or how do we remedy it. So I'm here with Dr. Uchechukwu Odom. He is the director. He's a director of disease control and immunization in the Imo State Primary Healthcare Development Agency. Dr. Odom, you are welcome to 60 Minutes Live.
Thank you very much, Tony, and then good morning, viewers.
Doctor, has anybody called you this period of any type of ailment or that? Because this season is the Harmattan season, very dry. That's what they call, what I call seasonal diseases and sicknesses. So can you tell us some of those diseases or sicknesses that people contact with at this period of the year?
Yeah, thank you very much, Mr. Tony. Actually, you know, we have two major seasons, okay, that occurs in a year. One is the rainy season, and then the other one is the almighty dry season, or Harmattan. You know, actually, any of the diseases, any of the seasons have some diseases that are actually associated with it. Now, you know, everybody is in a celebration mode, you know, and by so doing, a lot of activities going on. And you also realize that during periods like this, which is the Harmattan period, and this Harmattan period is mostly associated with a dry, dusty wind that actually blows across the West African coast. And this normally happens between December and February of each year. And now, when this happens, you know, there are some organisms that thrive well during the dry season. There are some organisms that also thrive well during the rainy season. Now we are now particular about the dry season, which is the Harmattan. You agree with me that as soon as the Harmattan sets in, you see some people started complaining. Some will not tell you that they have sore throat. Some will tell you that it's like, what is happening? I'm having catarrh, you know. And some will not tell you, what is happening is like there's a rash. Some, especially in children, will start having what we call watery stooling or diarrhea, you know, as the case may be. And some of these things actually happen. You see some having chickenpox, some have measles, you know. Some of these are the diseases that are actually associated with the season in which we are. And even amongst the children, which also occur in adults, we have some have cholera, you know. So these are the things, and we are likely to expect or to watch out within this period of our festive season. Thank you very much.
Okay, you have really even talked about some of the symptoms. So these, let me use the word, if I use the word common diseases, are they, am I right to use the word common diseases?
You can.
Okay, so what are the preventive measures? Because you are in charge of disease control and immunization.
Yeah.
How do we control them so that we don't have them, because they say prevention is better than cure?
Yeah, thank you very much. Just like you rightly said, prevention, they say, is better than cure. Not just better than, it's also cheaper than cure. That is why we in the public health sector, we dwell more in preventive measures, okay? And then if we prevent diseases from occurring, we would have saved so much for the nation. Absenteeism from work will no longer be there. Long stay in the hospital, payment of hospital bills will be reduced to the very minimum, if not eliminated at all. Now, first of all, let's take it from this angle. This is a festive period. Everybody is in the celebration mood. When we go to the, I remember when we were little children, we were always excited that we were traveling home. You know, so by the time you enter the villages, you see some trying to go to the bush certificate. Some go close to the stream. Okay? And so we will do that ignorantly, without knowing that, assuming someone or one of us is harboring Vibrio cholerae. Oh, okay. Then when you stew, or some even throw it inside the running stream, as the case may be, and some people will now be swimming in those streams as well. So what I'm trying to say in effect is, people should avoid defecating anywhere and anyhow. You should make sure that you wash your hands properly before you eat, especially foods like vegetables. You must wash them properly under running tap, or use water and wash them very well before you can eat them. Then you make sure that if you use the lavatory, make sure you wash your hands with soap and water. Now, the other way you can also prevent some of this, like especially, you can avoid going to overcrowded places. Okay, because most of these like chicken pox, and even including monkeypox, most of them are contagious. So by the time you get close to someone who is already infected, there's every tendency that you get infected. And then, but like a few months ago, we introduced rotavirus.
What?
Rotavirus vaccine.
Rotavirus vaccine.
Yes, that's Rotarix. We introduced in the states. Okay, we joined some other states in the country. Wimo is one of the first states that actually started immunizing. So these vaccines are also in our respective health facilities, health centers in the state. And then mothers, anybody can avail him or herself of that opportunity. There are also some other childhood killer diseases that can be prevented through vaccines. All these vaccines are all there at the primary health care for our children to.
Okay, Dr. Uchechukwu Odom.
Yes.
You have really outlined so many things. To me, with my level of experience or exposure, they look blues to me. I could have asked you who are the vulnerable people, but I'm talking. Let me now just jump to this one. What type of advocacy do you people use that people are not aware of all this? Like you say, you introduce rotum, something, immunization, all this type of thing that's supposed to. What advocacy system are you using to let the people know that these things are there, they can be prevented, and for us to remain safe?
Yeah, thank you very much. Like I said earlier on, a new vaccine, that's Rotarix, or rotavirus vaccine, was introduced a month about ago. And then before you do that introduction, we must do what we call high-level advocacy and engagement stroke sensitization meetings, which the media were called, both the electronic, the print media. We also had a high-level advocacy visit to the traditional institutions, first to the Ezeimo, and also we advocated and then addressed the Ezes during their meetings. We also called the religious leaders, and now we also called some other interest groups like the Nigerian Medical Association, the National Association of Nigerian Nurses and Midwives, and all stakeholders. We have a line list of them. So you cannot just. So these are all people. They won't, like if you listen to some of the radio stations, including your television, you see some adverts which sometimes governments sponsor them, sometimes our partners sponsor these. So there are we have advocacy visits and then engagement with our stakeholders in the state before we introduce.
Okay, let me go to this way because time is not at our favor. One is that do we have cholera in town, and two again is that when you talked about contagious, like this is dusty, and like me, for the past 2 days I was having catarrh. I thought if COVID has come back, but somebody now said I should be able to use nose masks to be able to. So what all these things? One is, do we have cholera in Imo State? If yes, how far, what to do, and again, the use of face masks, is it being abolished? Because COVID is, that's our last question for today.
Yeah, thank you very much. The truth about the matter is this. Yes, diseases are there, contagious diseases. Like when we say contagious, it means that an infected individual can infect
the other person.
People who are said to be held in quotes. And most of the times, it is not as if maybe when you come around somebody who is already infected, you get infected. No, sometimes your immune status, your immune system can also determine or protect you. And that thing again, if the individual is also vaccinated against those diseases, definitely you may stand protected, which sometimes, even if the person or the individual contracts that disease, because you have some level of protection, it may not be as severe as somebody who has no immunity against it at all. Now, on the issue of the face mask you're talking about, well, like as you said, Harmattan period is the period of dry, dusty wind. Okay, it does not just mean that because within this dust, a lot of pathogens, a lot of organisms are actually embedded in this. Do you understand? So if you inhale them or by any means you get enter into your respiratory tract, it will start causing problems. Now, when you talk about use of face mask, yes, face mask has been there even before the advent of COVID-19. But these are all preventive measures, which I don't think we'll lose anything by wearing our face mask. I don't think we're going to lose anything by washing our hands with soap and other running water. I don't think we will lose anything by avoiding going to some crowded places. Yes, COVID-19, by the grace of God, is actually coming down because of the efforts my office, the Minister of Health, and even His Excellency has put in place to make sure that we get our people vaccinated. If you remember, when COVID-19 came on board, he and his family, including an cabinet, they came openly and received this vaccine to tell the Imola that, yeah, this vaccine is actually safe and it is protective. You know, and that is why, and the Imolas have actually imbibed that almost everybody, because the rate of vaccination against COVID-19 is on that side, including the rotavirus we told you we introduced, the rotavirus vaccine. So if the awareness, like as you said earlier on, is well created, that's why we are now putting to our table, sir, you use this opportunity, tell the Imolais, tell Nigerians, yes, some of these diseases are preventable, and when you get to our health centers, definitely the health workers, well trained, vaccines, well stored, are there to deliver these vaccines to our Imolais.
Okay, there you have primary health facilities in almost all the communities in the state.
Yes, you do.
This festive period, do you has your agency been able to stock those places, because the drift is going to be from town to the villages, so that in case if there are some of these cases, they'll be able to manage them and they give.
Yeah, thank you very much. You know, like as I said earlier on, you know, just every ward and almost all the communities in Imo State has a functional health center. It was made as a point of duty for at least a minimum of one functional PHC per ward in the state. And let me shock you also, you know, that these are basic healthcare provision fund, which makes it possible for us to have minimal drugs in stock. So to answer your question, the health center is open, the drugs are there, the vaccines are there for our children, for Imolais to access, for minor ailments and minor injuries. If no matter how, if they come, if it's something the health worker on duty cannot handle, then you do a referral to the second facility.
Dr. Uchechukwu Odom, the disease control and immunization director in the Imo State Primary Health Care Development Agency. Thank you for educating us and enlightening us today.
Thank you very much.
Okay, so Hennes will call you. You'll be able to come and see that what we are doing here. If you start giving your agency the bill, I don't think advocacy is at its peak here, because this program is both on the YouTube and the Facebook, and anywhere, anywhere in the world, they are watching us live. Thank you for being our guest today.
Thank you very much. So still do that. It's part of your corporate social responsibility to make sure you educate our people, okay? So that once we have some health issues like that, or maybe for them to know that these health centers are existing and they can actually go there and access care.
That's one of the, that's why NTA stands tall amongst every other television station you can talk about in Nigeria, because we are at the forefront of educating and doing social responsibility things. Thank you for being our guest.
Thank you very much.
Yeah, the Imo State Doctors Association had a workshop yesterday where they empowered women to be self-reliant, so that they don't rely or start looking for money from any other person. They held an end of year party, and that party had too many guests that were there at that event, and the awards were given to deserving women. They had talks, shows, and were able to educate them where they can make things and be able to help their children and their husbands. And the ceremony was graced by too many dignitaries. Let us sit down and watch the clip of that event.
Witness the 2022 end of the year seminar and award presentation organized by the Imo Daughters Association. In her welcome address, the president of the association, Barrister Mrs. Chinaka Ogidi Adadiorama, said the association is aimed at training and empowering women so as every woman will have means of livelihood. The chairman of the occasion, Barrister Osita Ademugwafo, applauded the efforts of the association for empowering women to be useful to their society.
Facilitate the process of engaging women in different crafts for them to be aware of what to use certain things we neglect to produce usable items that can help the households. More especially in the kitchen. Another one is getting certain things in the market, like they produce bags, produce cold water, make it to be chilled. They use all these plantain stem to fashion out bags and other things. There are stoves which they make, locally made stove through charcoal. That charcoal, that one doesn't have much heat. It has no black something. It doesn't emit nonsense gas. But everything is done in such a way that people will live their normal life. No air pollution. That is why, one of the reasons why. And the Imo daughters have come to bring women who are interested in learning these arts to come and learn.
Chief Benjamin Ezeyon described the association as a philanthropic oriented that are involved in empowering women to attain greater heights. They charge other organizations to follow suit.
Not a member, but going by what I have seen and what I have heard, this is one association too many that is deeply involved in the empowerment of rural women, Imo women, whether you are high or low. It does appear to me that it is philanthropic oriented, and let me say it is an association too many.
The Secretary General and State Organizing Secretary of the association, in their respective speech, stressed the need why women should be empowered in the society.
About the dance for the vulnerable, empowering our fellow women. My advice goes to every woman in Imo State, both our daughters and all the women. I want to advise them to join Imo Daughters. If you look at what happened today in the end of the year party we had today, we had the opportunity of making people to know that from waste you can create wealth. So
the event featured raffle draw, dancing competition, and lecture delivered by Dr. Mrs. Ngozi. Topic: the use of ICT from waste to wealth creation.
I took you by surprise.
That was the Imo Daughters Association workshop and empowerment program and the end of year party. That was a colorful ceremony that was held yesterday. We pray to God that by next year many people will support them, because when women are empowered, the nation is all empowered. So that's how much you can go today on 60 Minutes Live. We thank you and thank God for seeing us till this date. I pray for every Imo people, every Nigerian, every person in the world that is alive today. May you see the new year in Jesus' name. So on the behalf of management and staff of NTA, we thank every Nigerian, every person who watches this program, and we say God bless you till next edition.